Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. There were over 49 million confirmed cases of COVID-19 globally. As at November the 6th, over 32 million people had recovered and the number of deaths is more than 1.2 million. The 9 most affected countries have 65% of the global burden. In Nigeria, there were a total of 63,731 infections, out of which 59,844 have recovered and 1,154 have died. Recovery rate is about 94%. Case fatality rate is 1.8%, and 673,183 samples have been tested. That's just over 47,600 samples in the week. For many months, the Presidential Task Force on COVID-19 has been urging Nigerians to abide by preventive measures against COVID-19. Now, there's an added concern that some people are refusing to take a test on arrival in the country. Plus, Lagos is warning of a second wave and possible lockdown measures. My guest is Head of Prevention Programs and Knowledge Management at the Nigeria Center for Disease Control, Dr. Chinwe Ochu. She joins us from our Abuja studio. You are welcome to the program.
Thank you very much, Mary. Thank you for having me on the program, and a very good afternoon to all Nigerians.
It's great to have you. Now, the reports that people are coming in and they're not taking a second test, what is the implication of that to us in Nigeria and maybe the rest of the world?
Yes, unfortunately, Mary, that is happening. As a country, we have been very, very fortunate coming through the first wave of the outbreak. And we've been so fortunate. God has been so faithful to us and been recording decline in a number of cases. But unfortunately, people have taken that to be that the virus is gone. And we've seen a lot of complacency in our communities. Just get out on the street and you see people moving up and down without their face masks. Unfortunately, also, travelers who are returning into the country are beginning to flout the rule. And they are not, some of them, just a few of them anyway, are not going back to get tested on the 7th day of arrival. The requirement is that before someone leaves a foreign country to come to Nigeria, you should get a COVID-19 test by PCR within 72 hours of departure. And then it goes to the website of the Nigeria Center for Disease Control and fills out a form in our travel portal, providing the details, and then selects a private lab where it will get tested and makes payment for that test. And then a code is generated. Then it comes back to the country. It's expected to self-isolate for 7 days, after which it should present to that lab where it made payment for sample collection and test. And if the result comes out negative, the person is free to get reintegrated into the society. So it is a mark of high irresponsibility for someone who has been, granted that privilege of returning into the country in this stage of the pandemic, where we know that many countries are not having it as fortunate as we have had it in Nigeria. And then you would want to come back and expose other people to that same risk that you faced in that foreign country. So the danger there is that we may miss some cases if these people don't get back to get themselves tested and confirmed negative before getting reintegrated into the society. And the Presidential Task Force is not taking this lightly. Remember, we have the records of all the people that come into the country. We have the details, including the passport details. And the PTF is frowning at this, and currently they are blacklisting all those that have not gone back to get tested. And their passports will be labeled, so they won't be able to travel in the next 6 months. So it's very unfortunate. We are pleading with people to please ensure that we build on the success, the gains we have made from the first phase of this outbreak, so that we don't go into the next wave, the second wave, because it could be very disastrous.
Why can they even refuse? Can they be fished out? Because what we're doing here is, you know, kind of like, we're not preventing anymore. It's like punishment. We could look at it that way.
I wouldn't really say we are not preventing. Remember that before entering into the country, you have to show that you are COVID-19 negative. So within the first 7 days, the risk is not that high, but we also have the details of these people. So it's not as if we can't track them. No, they are being followed, and immediately the person does not present on the day he's supposed to present for test. We are usually alerted because the state's public health department in that state where the private laboratory is works very closely with all those labs that are testing for COVID-19. So it's flagged off, and remember, we also have their contact details, so they can call them and follow up on them. But where the person persists and refuses, remember, we can't arrest them, so to say, but we can enforce this penal measure just to discourage people from doing that. There are a lot of people that are going out on the street and flouting all the public health measures, and nobody has arrested them. So we keep pleading and appealing to the conscience of Nigerians to see it as our own responsibility to our country, to keep this nation safe, to maintain what we have gained so far, not allow ourselves to begin to experience another wave of outbreak. Our health facilities could get really overwhelmed. Even our health workers are getting fatigued. So we can't afford to have another wave of the kind of outbreak we had. It might even be worse than that. From what we have in our records, in week 43, we had a total of just 162 cases. But between week 43 to week 44, we had a high increase. And now we recorded about over 480 cases. That's over 76% increase. So if we keep having this kind of increase in the number of cases on a weekly basis, then we might be headed to another wave of the pandemic, which will be very, very unfortunate, because this is something we can prevent. This is something that we don't really need so much to be able to prevent that second wave.
Some people
so hopefully Nigerians will, all of us will realize that we have a responsibility to keep this country safe.
Okay, some people believe you can't actually stop a second wave because of the way this virus is, that it will eventually burn out on its own. Is that possibility there?
Well, I disagree with that. It's very, very possible to stop a second wave. This is a virus that is transmitted from person to person. And we have, at least by this time, understood how the transmission happens. So there are public health and social measures that have been shown to work very well in containing the virus. We have even experienced it in our own country. So by the time we maintain that physical distancing that prevents whatever is coming from the respiratory tract of an infected person from getting to another person, and we continue to maintain good hand and respiratory hygiene, keep our environment safe, wipe off surfaces, it has been proven, it has been shown by evidence that it slows down the transmission of this virus. And we have experienced it as a country. So we can actually stop the second wave if all of us take responsibility and we do what we're supposed to be doing, rather than this complacency that is everywhere and even denial of many people think there is no COVID in Nigeria. So, and they keep taking risky behavior. If you go to the market now, you see, you can count the number of people that are wearing masks, face masks, I mean. And even those that are wearing face masks, they don't wear it properly. They either hang it on their chin or they cover just their mouth and leave their nose exposed. For you to really, for you to have the full benefit of wearing a face mask, you must wear it properly. Wearing it improperly is just as good as not wearing a mask at all. So if all of us can do this, wearing this mask when we're in public spaces or public places, and ensuring that we maintain that safe distance in our churches, in our business places, wherever we have to gather and we have a lot of people in the place, we try as much as possible to maintain that safe distance of 2 meters. That can really slow down the transmission. And remember, Mary, we are just coming out of a civil unrest that attracted a lot of crowds, with many of those people not wearing face masks or even maintaining this distance. So the fear is that we might be seeing this increasing number of cases as time goes on, but we can do something to stop it.
More than 2 weeks has passed since that civil unrest. Have the cases increased, or should we say that they won't increase anymore since 2 weeks have gone by?
We've actually seen a steady rise in the number of cases. The demographics of the people that were in that crowd were young people that are known to not show symptoms even if they are carrying the virus. So the tendency is that these same people could go back home and transmit it to the vulnerable. That is when you begin to have the severe forms, those that are aged over 60 or those with comorbidities. Then you begin to see them reporting in our health facilities. So it might take a while before we get off the effect of that civil unrest. So what we need to do now is to strengthen the public health measures that we're taking and the social measures, those non-pharmaceutical interventions of everybody wearing a face mask when you're going out in public places, washing your hands very frequently with soap under running water, wiping off surfaces, planning, corporate bodies planning to reopen safely, very safely, making sure there are guidelines and protocols and they adhere to those guidelines in line with the COVID-19 protocol that we have developed at the Nigeria Center for Disease Control, and that is also being propagated by other partners and the Presidential Task Force. If we all adhere to those guidelines, we will be able to contain what is about to happen. That is why we are warning, and I think that's why the Lagos State government is also crying out, because they've also noticed a high rise in the number of cases.
Now, for the second time,
yes,
Lagos is recording cases in a boarding school, except that this time it's on the mainland. Some people have caught the infection. It's a very difficult situation when you have to appeal to the consciences of people and to their better sense and all that. Is there nothing else we can do? Or perhaps a different approach to make people actually do these things? Because initially when it started, at least there was some response. Some wearing of masks, some social distancing and all that. But I hear people saying COVID is gone. We don't have it anymore. Is there something else we can do?
This is a global problem, Mary, all over the world. People are having to deal with this issue of infodemics and misperceptions and community complacency. Well, though it's more in some countries than in others, and in Nigeria is a big problem. We don't think that it will be possible to start using all those penal measures or that it will work. Rather, what we intend to do is to continue to use evidence to intensify community sensitization and risk communication activities like we're doing using all platforms, media platforms, especially the social media that a lot of our youth have access to. So is to increase the awareness and to show from our data that we are not crying foul, that this is exactly a big problem, and we keep showing that steady rise. You can imagine for Lagos, It was actually like Lagos that recorded 162 cases the other week, and eventually had 480 in week 44. So that is alarming, quite alarming.
It is.
Nationally, in week 43 from the record I have here, we had 552 cases. Then in week 44, we recorded 972 cases.
Let's quickly take a break. So we'll come back to all that. We need to take a break now. We'll come back to all that in a minute. Please stay with us. Welcome back. It's Health Matters on Channels Television, and we're talking about avoiding a second wave of COVID-19. The number to call if you have any questions is 0805-468-3514. That will be showing on your screen in a minute. And you can also tweet at CTV_Mary A while we continue the conversation. I have a message here from Bamboye Shegun. He says, my mother paid 52,000 naira for her test on her return from the UK in September and was told mail or phone call will be made to her, but till this moment, nothing like that has happened. Okay, so let me go back to Dr. Ochu and ask her what could have happened.
Okay, Mary, it is private laboratories that are responsible for testing those that are coming into the country. And they usually pay for those tests through the portal, but the money goes to the private laboratory. And they are supposed to actually communicate with the individual. There is a code that is usually generated at the point of registration and at the point of payment. So we know there have been some hitches in a few of the laboratories, especially those outside of Lagos and Abuja. And some people could not get themselves tested on the 7th day. So the PTF is working on that and compiling the list, and they are going to be refunded their money. So apart from those few hitches, it has been moving on seamlessly, so to say. So if anybody has any complaint, if you have made payment and you have not received a call, and if you registered, you came in through Lagos, if you go to our website, even on the portal, there is a link where you can send your complaint to so that it will be addressed. Or you can also send to us at NCDC, or even give us a call so that we can follow up. So these are all hitches that are not unexpected in a large program like this, but we are working very hard to address them. So
Shegun, go ahead and make your complaint and let's know how it goes. But while we're on the subject, why is the price so steep? Is there no way it can be, I mean, it's not only rich people who travel.
Well, the PCR test, which is what we are using currently in the country, is a very, very expensive procedure. And why we are doing that free in our public health response, it does not mean that it's actually free. So the government and some well-meaning partners are contributing to ensure that Nigerians get these tests free in our public health response. So for testing the public, the government labs do these tests and they do it free of charge. But where private labs now have to do this, because we can't be utilizing these very scarce resources for people who do not meet the case definition, maybe people who are coming into the country or those who want to travel out. So that was why we had to optimize private laboratories to be able to do these tests. And they are the ones responsible for putting in all the facilities, the infrastructure, the equipment, everything, even the PCR mesh, everything they need to be able to test. So they can't do it free of charge for people.
Let me quickly get this
That
question
is, unfortunately,
in.
that is as high as it can be, yes.
All right.
The cost for a PCR test from these private laboratories range from about 42,000 to over 50,000. So that is what it is.
Let me quickly get this question in. Some people complain that they fill a form, they're invited for a COVID-19 test, but when they get to the free labs, the government labs, they are turned back. Can you explain to us who is eligible for a free test and who must pay so that Nigerians know where to go?
It's important you're asking this question, Mary, because like I said before, the free test is within our routine surveillance system. And in that system, in that structure, you don't even go to the lab directly to get tested. There are sample collection centers. So once you're having COVID-like symptoms and you call those numbers or you get to those centers, samples will be collected and sent to the labs. The labs do the tests and get the results back to the state public health officials who will communicate to the person. So that process is free. But where on your own you decide, I want to travel out of the country, usually that set of people, and you want to get tested, you're not having symptoms, you do not meet the case definition for COVID, then it's expected that you go to those private laboratories and not to the government laboratories to get it. Nobody will even attend to anybody at the government laboratory if you go there. Even through the normal surveillance system, you're not expected to go physically to the laboratory to get tested because all the precautions are in place at the sample collection centers where the samples are collected. So these are the people, those that fall outside of the routine public health surveillance, they are expected to pay for their tests.
But isn't this why we are having breakouts in schools? Isn't this why we're having breakouts in schools? People go to school, they don't meet the case definition, case definition for testing, and they just go to school because probably they can't afford to do a private test, and there's a breakout in the boarding house.
We're not even asking people that want to get back to school to go and do a private test, no. There is a guideline, a clear protocol that has been developed collaboratively with the Federal Ministry of Education. It's a very robust guideline that is clear on what schools should do to stay safe. And if there are cases in school, like you have a suspected case, each school is supposed to have a holding area where you keep anybody with COVID-like symptom. And then you're supposed to contact, that school is supposed to contact the state public health department using the numbers that are readily available to them. And they will come collect sample and do that test for the student and use the normal public health and social measure intervention that we have of isolating and treating and then tracing the contacts. If this is done properly, there won't be any need for us to begin to say, let's test all the students before they come back to school. That might not be feasible. That could be ideal, but in a country like Nigeria, where we have very limited resources, it will be very difficult to do so. So in schools, we expect that at every point in time, they maintain that safe physical distance of about at least 1 meter, especially if everybody is wearing a face mask. And remember, for those in the dormitory, especially schools that are purely a boarding school, once they are there for about 2 weeks or more, you don't expect that you'll be having cases amongst those because they would have exited the incubation period of the virus. So if they strengthen and tighten all these public health measures and they're able to comply with the guideline, the protocol that has been so beautifully laid out through this extensive stakeholder engagement, the fear of having outbreaks in schools will not be there. We will not be having those cases.
Thank you so much,
remember,
Dr. Ochu.
From what we have seen, most students that have these cases, except they transmit it to the adults, many of them recover very well.
Thank you so much for being on the show. Thank you for honoring our invitation and giving us such clear answers to the questions. Have a lovely day. Thank you at home also for staying with us. My name is Mary Alale Yusuf.